Okay, so I've got someone who will be familiar to many people with me again today, which is Michelle Worden. Just to give a little bit of background on Michelle, she works as an advanced neonatal nurse practitioner at the Countess of Chester Hospital, where Lucy Letby worked, and she knows many people from that area and probably people that still work at the hospital today. So we've spoken to Michelle twice previously, so if you haven't seen those interviews, please check those out as well. And we're just going to be discussing various issues today, and also I've asked for questions from viewers for Michelle, and we're going to be addressing them. So, first of all, hello, Michelle. How's it going?
I'm very well. How are you, Chris?
Yeah, I'm not too bad. Not too bad. You've been in Spain. I've obviously been getting rained on for the last 6 weeks. It's been torrential rain here constantly. Do you have a good time?
Yeah, we had a lovely time, thank you. It's a shame to come back to the cold.
Yeah, yeah.
At some point, you have to come home.
This is true. This is true. So we're going to talk about various things today, but the first thing I would like to discuss is the Channel 4 documentary because this has been broadcast since we spoke last. So the floor is yours. What did you think about the documentary?
Okay, well, I'd known the documentary was coming for quite a long time because I've been in contact with the producer, Daniel Bogado, and some of the other producers involved in it. In fact, I actually filmed for them, but they changed the remit, I think, as time went on. Um, I was invited to the opening, but I was on in Spain, so I didn't actually watch it until it was shown on Channel 4 on the Monday evening. I'd heard various things beforehand, so I have to be honest, I was a bit apprehensive about it because I'd heard that they were giving a very vocal part to Dowie Evans, and having listened and seen Dowie Evans speak in other um, programs, I was a bit hesitant. Um, he he didn't fail to disappoint, didn't Dowie? Because he did exactly what he's done in other documentaries, and he seems to have be totally incapable of looking at any other points of view other than his own. He's totally adamant that he's right, everybody else is wrong. He in this documentary talked about the elite and that everybody was coming out of London and was criticising him because he was Welsh. Well, I've never heard any of those sorts of comments, and I'm certainly not in London. And nor are other people that I've heard on various podcasts and programs. So I don't know quite where he gets that from. He was just definitely, again, I'm right, everybody else is wrong. I know what I'm talking about. And I think in medicine, that's a very dangerous position to put yourself in because medicine, as we've discussed in the past, is not an exact science. And sometimes it does boil down to professional opinions and looking at other mitigating circumstances. And he's never done that. In fairness, neither did the police. The police, having had Steve Brearey and Ravi Jayram turn up and say it's Lucy Letby, they also never looked at anybody else. They didn't examine any mitigating circumstances, which I keep harping on about, like the staffing and the unit receiving more babies than it was even funded for, had incubators for. So yes, I think he just showed himself up really in the documentary. The parents, I feel desperately sorry for that were filmed. It is obvious that that mum had a normal pregnancy, and I don't know, but I would suspect that something has gone terribly awry during the labour. The baby was whisked off, and those poor parents were left in a delivery room not knowing what was going on. We know that the baby was eventually transferred to Liverpool Women's Hospital for what's called brain cooling, which is clearly indicative of some sort of hypoxic event which will have happened during that labour. They said that Lucy came in with a treasure box. Now, the treasure box has been misrepresented. It's not a memory box. There's two different sorts of boxes within neonatology. One is a memory box when a baby has tragically died. And one is a treasure box, which is to try and give a mother some sort of tangible things about her baby. She's separated. Mothers and babies should not be separated. But when a baby is sick, they are separated. So we don't even know if it was Lucy, because they said that they recognized her from a photograph, but memories can fade and memories can play tricks. So we don't actually know if it was Lucy. We don't actually know if Lucy was on duty, though I presume she must have been, because they said that they'd been contacted by the police at some point. Now, they'd been left in a delivery room for a period of time, not knowing anything. And then somebody walks in with a box, and their first response was, "Oh my God, is that my baby?" And I can imagine I would have done the same thing, going, "Oh no, don't be silly. I've just brought you this. I brought you photographs of your baby and a cot label and a wristband. So you've got something tangible, because your baby is in the unit and is poorly, and we're going to bring you through it some." But this is a starting box. When they said that she cracked out laughing, I don't know. I mean, I wasn't there. That's their interpretation. But I think there's a lot of things that have been misconstrued in this. If I had the opportunity to speak to these parents, because they've obviously been left very high and dry on what has gone on with their child. They said that their child has global developmental delay, which could be a result of whatever insult occurred in labor. They said that their baby had, when he was 5, had started having seizures. I don't know if they've ever had a maternity review, but I would strongly advise them to obtain their maternity notes and to get somebody independent like Dr. Jim Thornton, who's now working with Mark MacDonald, or Dr. Martin Pittman, who's talked to lots of parents and is a consultant obstetrician, to look at their notes to find out exactly what's gone on. They didn't just have their baby taken away and then taken to Liverpool, so they've had all that trauma. But then years later, they've had the police knocking on the door saying, "We think Lucy did something to your baby." But again, there was obviously no evidence that Lucy had done anything, because this baby was not on the indictment. I got told by part of the film crew that these parents had approached the film crew because they've never had any closure. They've never been offered the counselling, or they don't have a lawyer the way the parents on the indictment have, but they've just been left literally high and dry with questions to be answered and nobody to help them. And I just think that is absolutely appalling. My heart goes out to these parents, but I would really recommend they obtain their maternity notes and seek a second opinion. I don't know if they've ever had an opinion via the Countess of Chester Hospital of what went on in labour, but I would want an independent one. So I don't know. I didn't really feel it gave the programme any validity, because they're not on the indictment. But these parents, there was clearly issues in this hospital. And these parents clearly highlight those issues because they've just been left high and dry. And I'm quite sure they're not the only parents that that's happened to. So overall, I thought the film was excellent. I thought Dowie just did what he always does. He, in the words of Shakespeare, he protests too much. I felt desperately sad for the parents. I thought it was a shame that Dr. Neil Ayrton and Dr. Savina Dimitrova didn't have a bigger voice within the program to highlight what they have discovered as expert witnesses within this case. But overall, I thought the documentary was very good, but it definitely left me with the feeling that these parents, and probably there are other parents, who really need to seek further professional help.
Yeah. So I think a couple of things that I would add are firstly, I guess we should just emphasize that these boxes are handed out with regularity, aren't they?
Oh, they're completely commonplace. Yes, every parent who is separated from their baby now receives a treasure box, and it is completely different to a memory box. Um, Parents whose babies have tragically died could well end up with a treasure box and a memory box, but it's very stressful for a mother who's just delivered to have her baby whisked away and not see it, not be able to cuddle it or kiss it or anything. It's immensely traumatic. And these parents were left in a room for what appeared to be a couple of hours, not knowing at all what had happened to their baby or whether their baby was either alive or had sadly died. And that's just another indication to me of definitely bad care, because somebody should have wanted to talk to these parents. And in my head, it's probably another indication that they were really short staffed, because if they haven't got enough staff to walk down a corridor, which is literally a 2-minute walk from the intensive care unit, to talk to these parents, then there's just not enough staff, is there? And that's another indication that things were very, very wrong in this unit.
Yes. The other thing I wanted to mention as well is that you spoke about Dr. Evans being unwilling to take on medical opinion. So I was reading a transcript the other day, and will be in relation to child C, I believe. And he's saying in court, of course, what medics do is we listen to other medics and take their opinion into consideration. This is when he's trying to defend himself in court, of course, which I
Yeah,
found so ironic, considering that now he could come into contact with the opinion of dozens of people that are obviously far more qualified than him, and he won't give any credence to them whatsoever. Obviously, he's alone in that. Everyone else is obviously aware that their view does carry a lot of weight, but I just found that really ironic that
yeah,
he himself in court said what medical people do is pay attention to the opinion of other medical people, and that's what I've done. Um, but obviously unwilling to do it when medical people disagree with him, of course. I mean, basically, what he did in the court case, to be fair, was prompt people to agree with him. He just gave them his reports. All the witnesses, I mean, most of the witnesses very minimally appear in court anyway, but he just prompted them by giving them his report and say, oh, look, I've worked out what's happened. And then they just went off that, basically.
yeah.
So even that is very limited in terms of listening to other people. But yeah, I just wanted to point that out.
And he also, I mean, we don't know how those other experts were appointed. Were
Hmm.
they completely neutral and appointed by the police or the CPS or the National Crime Agency? Or did they also, are they all friends together? There's certainly been rumours that he knows Sandy Bowen, and Sandy Bowen stepped in to be an expert off the back of Martin Ward Platt sadly dying. Um, and there is a lot of talk that Dowie definitely knew Martin Ward Platt due the other cases with Professor Roy Meadows. So, and the world of pediatrics, it's not a huge world. So the chances are he went to the police and said, yes, you need this expert and that expert. And certainly when we talk about the nurse expert, Elizabeth Morgan, she's
Hmm.
from South Wales. So I just have a gut feeling that he probably approached her and said, will you be the nurse expert?
Yeah, it seems likely. We don't know. We've never been able to clarify this. The police are never going to speak to anyone ever again until this is over. So we'll never hear anything from them. They obviously clearly don't consider themselves to be accountable. So I don't think we can say for certain, but I think it's quite likely because from what I've seen from the police, and I did this analysis the other day of Paul Hughes being interviewed by Liz Hull, and from what I could see from that interview, the chances that he put together a team of people or that Cheshire Police did is very slim.
Well,
I mean,
the police were out of their depth. I mean, the police were
yeah,
completely, they're not
yeah.
medics. They're not statisticians. They were absolutely out of their depth and they relied totally on Ravi, Steve Brearey, and Dowie producing the babies that ended up on the indictment, cherry picking them, and writing the reports. And then the other experts came in and just verified that Dowie's reports were satisfactory. But
Hmm.
they didn't seem, I mean, Sandy Bowen did a little bit, and some of the babies, she questioned some of the things, but overall, she still agreed that it was air embolism or air down the nasogastric tube or whatever Dowie was saying. So, yeah, they were not objective at all.
She didn't systematically disagree with anything. So there was nothing where he gave evidence in court and then she said, "Well, I disagreed."
No,
Not one thing.
no.
So effectively, she's rubber stamped everything. Yeah, she might have said, "Oh, what about this or what about that?" Even Dr. Evans, he said, claimed to mention antibiotics. So that's I've been over that. If you look at his what he actually said in court, he downplayed the antibiotics. So even that was a claim that just had no credibility.
Yeah. And
But
that baby D, I mean, those parents were instructing solicitors. So there was a clear case of possible gross medical negligence. Um, and nobody seemed to have discussed that in court. And the coroner was due to have an inquest on that baby and dropped the inquest when he knew the police was involved. There was a police investigation going on. So it's all wheels within wheels, isn't it?
yeah, absolutely. So we've got a lot of stuff to get through. So we're going to look at this article now that's written by Liz Hull, and I wanted to ask Michelle about this because I'll share it on the screen. Um, she makes some comments about various things. So I wanted to highlight this sentence firstly. So Liz Hull writes here, although the 35-year-old supporters claim this fleeting interaction described in the film has been blown out of proportion and giving out such boxes is entirely routine, which is true. So that's all true. So notice like she begins the sentence with although. So usually when you begin a sentence with although, what you then do in the second half of the sentence after the comma is say something contrary to that. But she can't do that because that's true. So then she just goes, the couple's experience will feel all too familiar to the parents of the 14 children, which has nothing to do with nothing to do with the box whatsoever. So I just wanted to point that out firstly, and then I will just speak on child A, and then we'll ask Michelle to speak about the other children. So firstly, child A. Uh, there's a comment about a message that Lucy had written, where she's written, "Dad was on the floor crying. Please don't take our baby away when I took him to the mortuary. It's just heartbreaking." And then Liz also says, "Baby A's mother told the Thirlwall inquiry that this simply hadn't happened and was untrue." There were several text messages that came out through the trial that were lies. She said to me it was attention seeking, and that really should have been a red flag. So what I would say is that this text message was written at the time. Lucy's message is actually written at the time of this incident, whereas the mother is speaking after the fact based on memories. We've already discussed the reliability of memories. And the other thing I would say about this is that no one flagged anything at the time about all of this comes in retrospect after the police have prompted these parents, just like the parent that is in the documentary. So it's really essentially it's one person's word against another. I mean, I see no reason why Lucy would fabricate this. And of course, it seems like a very likely reaction that, the father would be sad and he'd be saying, "Please don't take our baby away." That just seems like an entirely plausible situation that could easily have occurred. And then, of course, baby A's mother now believes that Lucy murdered her infant. So naturally, she doesn't have a very favourable view of her. So her memory could be playing tricks with her. She may not have been there when this happened. She probably wants to find anything to criticize Lucy, which would be understandable if you thought someone had killed your child. So I just wanted to deal with that one firstly. And then the others, these are all from Michelle. So um, so this is just a bit of background to child seeing. It says the mother said, even though I was faced with a situation where my son was having CPR, I was still quite confused and disorientated as to what was going on. And until I was asked that question, it really didn't hit me that there was a chance he was going to die, which sounds probably quite strange, but my thoughts hadn't kind of caught up yet. So I asked her, do you think he's going to die? And she said, yes, I think so. At the time, I didn't know this nurse's name. I hadn't seen her before, but I believe this was Lucy Letby. Then it goes on. Later, when doctors told BBC's parents there was nothing more they could do for their son, Lucy had to be told repeatedly by the shift leader to stop going into the family room where they and close relatives were cradling him in his final moments. His father told the inquiry he was shocked when, during one of these interruptions, Lucy brought in a special cold cot and told them, "You said your goodbyes. Do you want me to put him in here?" I vividly remember when Lucy Letby prompted me to place BBC in the cold cot. At the time, I reacted curtly to her suggestion. She promptly removed herself from the family room. My mother-in-law also recalls this incident. Reflecting on it now, I believe she wanted to savor my son's dying moments for herself, which fills me with both emotion and anger. Had I not challenged her, she would have further intruded on our private goodbye to baby C. I think that's the end of it. Yeah.
I,
So,
I just despair because all of these parents they've had the trauma of having a baby born with significant health problems. Their babies have sadly died. Some of them have witnessed resuscitation, and that is very traumatic. You know, when you've got everybody around your baby trying to put in lines, resuscitate, shouting for drugs, shouting for x-rays. It's immensely traumatic. And then years later, in some cases, they've had the police knocking on their door. I just think all of these things have been totally taken out of context and weaponized against Lucy. It's like one set of parents said, "Oh, she sent me a bereavement card." Well, I've sent bereavement cards. I've been to babies' funerals. When Lucy does that, she's macabre, she's gloating, she's enjoying the death of our baby. I've taken cold cots in because you have to. It's all been taken so out of context, and it is now having a huge effect. And when I talk to my friends who are still working clinically, they say that parents are very apprehensive if they walk in, and some parents sort of look at you as if to say, "Why are you saying that?" Or because all of this has been what is normal neonatal nursing behaviour has been weaponized, and it's terrible for those parents because it's altered their memories, and it's really bad for neonatal nursing because nurses, as I say, that I know who are still working, they say it's very hard now to build up a rapport with parents because the parents are apprehensive and the nurses are apprehensive. When they listen to what's gone on with Lucy, there is a school of thought, is somebody going to point the finger at me? Is this going to be misconstrued? Maybe I shouldn't hold this person's hand or wrap their baby in a nice blanket because they might take offense to it. It's just a disaster on so many levels. It's just awful. And Liz Hull is culpable in exacerbating all of that because she has no idea what goes on a neonatal unit. She's a journalist. She's also got skin in the game. I've been told that she had her babies in Chester. She lives not far from Chester. So there could be a presumption that she knows some of these consultants. She's certainly been very vocal from even before the trial that Lucy's guilty. We know that her and her sidekick, Caroline Cheetham runs a media company that was paid by Cheshire Police prior to the trial to run media correspondence for Cheshire Police and to hold press conferences before the trial. And then they started the podcast that went all the way through the trial and was extremely pro-guilt. Whatever happened to this country with you're innocent until proven guilty? Because Liz Hull certainly was in the guilty camp long before the guilty verdicts ever came in. She's got skin in the game, and it's appalling, extremely poor journalism, and her articles are a disgrace on, again, so many levels.
Yeah, I agree, of course. I've generally ignored her, but as she's had over 2 years to show some sort of contrition and to backpedal a bit from her position, and she just doubles down more and more and more. Um, I'm not willing to take it lightly on her anymore. I think she needs to be held to account. I don't know as much about the background of her. Obviously, I know about the police payment and the company and all that. I don't know why she's doing this. I have a few suspicions, but um, I do think one of the things is that as soon as people hear, I would say particularly women, as soon as they hear babies have died, you know, it's so emotive. I think I do think she became. I mean, even though she's an experienced journalist and she could be quite savvy in what she's doing in many ways, and maybe this article that she wrote is untrue, but I don't know. I'm sure she would say it's true. But she wrote one article saying I cried in court. I never cried in court in 25 years and all this stuff. And I think she became emotionally involved. And I think now she can't admit that she's wrong. And the very small number of people that are left who still say Lucy's guilty, who know the case, there's some who still say it who haven't followed it, of course. But most people now that look at the evidence know that it's an unsafe conviction. I think that just a very small number of people that still say otherwise, they just cannot accept that they're wrong. I don't know if Liz Hull, if there's other factors, I believe there can be other factors. There probably are other factors, but I think also she's emotionally involved, and she just cannot admit that she's wrong. So she's written this article here that even obviously Michelle knows far, far more than I will. She's forgotten more than I know, but I can obviously see from this account here that Lucy has a job to do. She can't just leave the family indefinitely with a baby that's passed away. She has to do her duties. Sad. I mean, it must be an awful thing to do. I can't even imagine what it's like. I'm sure she didn't enjoy going in there, but she just performed her duties of what she has to do, and then she's just trying to get them to let go because that's what they have to do. And she hasn't behaved inappropriately at all. And one can, the guy says whether this is a correct recollection or not. He says that he reacted curtly to a suggestion. That's a perfectly normal reaction, and no one would think badly of them for that. And I'm sure Lucy didn't. I'm sure Lucy just thought, understandably, they're upset, they're emotional. I'll just get myself out of there, which is what she did. Anyone could.
When a baby dies, we had a parents' accommodation, and find you would put the parents into one of the bedrooms and take the cold cot in and take the baby in, and they were allowed to stay as long as they wanted to. But you also have to gauge it because every set of parents are individuals and react totally differently. Some parents just want to get the hell out of the unit. They just want to get out. They don't want to stay with their baby. They just want to get out and get home to their family and to grieve in private. Other families want to stay on the unit for days with their deceased baby. It is such an individual, private, emotional experience that is beyond the comprehension of anybody who has never, thankfully, had to experience that. And Liz Hull writing these articles is just weaponizing and I mean, it's like the trial. I can understand actually Liz Hull crying in the court because some of the parents' testimony that was given during the trial was heartbreaking. It was harrowing and it was extremely emotional. And I can completely understand her crying and members of the jury. The fact that Judge Goss allowed these parents to give emotional testimony, I am quite convinced played a large part in the jury convicting Lucy because the only facts that were there were these babies had tragically died. These parents had had these nightmare experiences, and Lucy was in the dock. The medical evidence that was presented in trial that we've discussed at length was all about how you sell a good story. But certainly the parents' emotional testimony was harrowing. And that was their personal experiences. And it must have played a huge part in the jury's decisions because that was their experience. They were there. That is factual. The fact that it's been used against Lucy never discussed in court. They didn't call any other neonatal nurses to say, well, actually what Lucy was doing was what we all do as neonatal nurses. It's terrible when a baby dies. It affects the whole unit. But nobody went to court to say, yes, if I'd have been there, I would have done the same thing. And as I said before, you have to gauge how some parents are. Some parents just want to get out of that unit, and some parents want to spend days with their baby. So you do constantly go in and out of the room. You know, you might say, okay, I'm going to leave you for a couple of hours now. Here's the bell. If you want me, please call me. Or other parents might say, no, I want you to come back in 30 minutes. You have to try and gauge how each individual family is going to react. And writing this sort of article does not demonstrate what happens in reality.
Yeah, all I want to add is that I don't think the parents' testimony should have been part of the court case.
No, I don't either.
I
I
understand.
think it had a huge part, and I think most trials, from my understanding, the victims, and these parents are the victims, are allowed to give testimony after a guilty verdict comes in. But Judge Goss allowed what I call this emotional testimony to be given during the trial, and I have absolutely no doubt it played a huge part in the jury decision-making process because it was harrowing. I don't blame Liz Hill for crying during the trial. It was just awful.
Yeah.
Awful.
Yeah, I agree entirely. So we'll go on to baby D. So it's background of baby D. Mother told the trial that she and her husband had to ask Letby to leave them alone with their daughter during their first visit to see her on the neonatal unit. She described Letby, who went on to murder baby D with the injection of air into the bloodstream hours later, as hovering around their daughter's cot, watching them and making her feel uneasy. She could have just left us to it, but she stuck around, baby D's mother said. She was watching and looking over to us, and I asked my husband, can you tell her to go away or give us some privacy? Baby D's mother later told the public inquiry, I don't know why she stood out. I didn't catch her doing anything in particular. I just remember thinking, this person does not belong in this situation. Why is she here? She also described Letby watching the couple crumbling during attempts to resuscitate their daughter. I could see Dr. Brunson holding her baby D and trying to save her. There was a lot of people. One that was doing nothing useful, that was Lucy Letby, and she was just looking at us crumbling and crying. And Dr. Brunson was trying to save my daughter, and he was trying really hard. So just, I mean, I could comment on this, but what do you think, Michelle?
Well, this baby was obviously deteriorating. Now, was Lucy looking at this baby as if to say, I'm going to have to intervene here because this baby is deteriorating and nobody else was picking up on that? As a neonatal nurse, she has a duty to keep an eye on that baby. You know, that baby had just been admitted, was obviously sick. So I don't understand why the parents are saying we wanted to be left alone, because this baby was in a neonatal unit. You don't leave babies alone in a neonatal unit because of the risk of collapse. Again, in court, it was said that these babies suddenly collapsed and suddenly, had unexplained desaturations and bradycardias. But to me, having read a lot of documentation now, you could see that, these babies obviously had problems antenatally, and we've discussed the lack of maternity input into this trial. But as a neonatal nurse, if I've got a newly admitted baby or a baby that I think doesn't look quite right, maybe is going to deteriorate, I'm not going to leave those parents either. I'm going to hover, uh, because you need to be there. You don't leave them. So I think again, this has all been taken out of context. These parents, we know. I mean, there was clear medical negligence on the maternity side with this mother. She had prolonged rupture of membranes for 60 hours and no antibiotics. So it's not difficult to understand why this baby was born with a rip-roaring infection and got pneumonia. And again, to me, a baby born with a pneumonia who's been exposed to potential bacteria that obviously in this case was lethal, you're not going to leave that baby. And we certainly know that these parents, after this baby died, were about to instruct solicitors. I think they did instruct solicitors, and then it was all dropped when the police went knocking on the door and said, actually, we think this is about Lucy. But this baby is a clear case of medical negligence on the maternity side, in my head. You don't have a woman with ruptured membranes for 60 hours and don't give them antibiotics. And this baby also didn't get antibiotics for at least 4 hours. I mean, that was another negligent point. I think this baby was delivered and the father kept calling the midwife back saying, doesn't look right. And then he started grunting, did the baby. And eventually at 4 hours, they took the baby to the neonatal unit. But not only did they fail to give the mother antibiotics, but as soon as that baby was born, it should have had a full infection screen and started antibiotics straight away. But there was a delay of at least 4 hours.
Yeah, so I'll mention a couple of things. The first thing is that lots of nurses have obviously echoed what you've just said with regard to Child D. And I know a friend of mine who was a nurse, thinks that it's outrageous essentially that the parents haven't been compensated. Um, I mean, it's harder for me to comment on that. I obviously accept other people's views and try to take them on board. I try not to comment myself too much about inadequate, if I can cite an expert, I will, but I try not to talk about it too much from my perspective because, I've never been in a hospital and I've never had to give care or anything. So if I can cite the views of someone who knows, then I will, but I try not to comment myself. And then what's the other thing I wanted to say? Oh yeah, I can't remember now. It's not that important anyway. The most important thing. Oh yeah, I know what I was going to say. So we should mention as well. So you're talking about the parents are going to be compensated. The parents are going to take action, and all this sort of thing. So we now have the email from Ian Pace, who was a lawyer associated with the hospital, and he's writing about Lucy's grievance procedure, and he tells the hospital the best case scenario we can have is for Lucy to do constructive dismissal because we'll pay less money out that way.
Yeah.
Otherwise, we face the prospect of being sued by parents, and that would be a less favourable outcome. We've just had this article, I've just sent it to you yesterday, Michelle, about £60 billion in medical negligence in this country. And what was it? I've forgotten what article you sent to me, but it was the maternity scandal, wasn't it? Leeds. Yeah.
I mean, the maternity across the United Kingdom is in absolute crisis. So we've had Morecambe Bay, East Kent, Shrewsbury, Nottingham. Now Leeds has come on board. I've heard of other hospitals. West Streeting has announced that there's going to be a maternity review of 14 hospitals, in addition to the ones I've just named. And yet in Chester, they had a serial killer. It's this cost cutting left, right, and centre. You only have to look at people's experiences, like Dr. Martin Pittman, what happened to him, calling out lack of midwives, delays in being able to section women because of the lack of midwives, having staff that are not registered. So they have a role to play, but they are not as highly qualified as a registered nurse or a registered midwife. They don't have the appropriate training, but they're being asked to look after mothers and babies who have complex needs, and it's above their level of knowledge. It's not rocket science to work out what is going wrong in these hospitals and why. Because if you've got a midwife on labour ward who's looking after 2 labouring women, she's effectively looking after a minimum of 4 people, 2 of which you can't see because they're still in the uterus, and she's running between rooms. You know, and if it's a multiple pregnancy, it's even more high risk. So it's these maternity hospitals they need a complete overhaul, a complete inquiries like Donna Ockenden is doing. I don't know how Wes Streeton imagines that Baroness Amos is going to be able to look at 14 maternity hospitals within 3 months, because Donna Ockenden's doing reviews, and I think she's 4 years in and hasn't finished with her review. So I hope Wes Streeting is not just going to do another whitewash inquiry that we have seen with the blood scandals and the post office and various other scandals.
Every inquiry that's ever taken place, basically.
And Thirlwall. I mean, we've got to throw Thirlwall into the mix, because she's working on the presumption of guilt without listening to any of the new evidence or discussions that are swirling around Lucy's court case. I don't know how she's ever going to be able to write her report, and she's certainly kicking it down the road at the moment, because it was due to be out, I think, next month, and now it's going to be in the new year. So,
well, I think originally it was September, even.
Yeah, it could have been September.
I mean, I really have no idea what they're going to do next. And I do have a very, very small amount of sympathy for her, because she's genuinely in a very difficult position now. But I don't have that much sympathy. She got paid $500,000 at least. So
Yeah.
I really don't feel that sorry for her. But obviously, objectively, she should stop the inquiry and say, we're not going to do anything. We're not going to have any recommendations, and it's going to be paused indefinitely. But we'll have to wait and see what happens.
But she should have done that. I mean, there was numerous amounts of experts who wrote her a letter asking her to relook at the terms of remit, and she refused. I don't know if it was actually her that refused or somebody behind the scenes in a higher position, but she definitely should now, with everything that's coming out, come out publicly and say, I am not going to put my reputation on the line by continuing with this inquiry, because we're actually not getting to the truth, and there's too much information swirling around it for me to write a report.
Absolutely. So let's move on to the next infant. So we should say, firstly, child H, Lucy was not found guilty on this infant. So baby H's parents were also handed a memory box. Baby H's mother told the Thirlwall inquiry she felt the box was quite morbid and made her feel uncomfortable. There was also a plastic bag with a white sticky label. To me, it almost seemed... So there's literally nothing to say about that, because it's just exactly the same thing as the other parents. So we won't even talk about that.
But that goes back to how individual and personal these experiences are for each family and each mother and father and the siblings and the grandparents. Some parents will want a memory box. Others, I've had families where the grandmother said, "Give me the box, because it's not the appropriate time for my daughter or son to deal with this, and I will give it to them down the road in a few or after the funeral." It's such a personal thing. You can't have a blanket cover for these things, because God forbid, none of us have been in this position, and we don't know how we're going to react. We don't know how we're going to feel. it's just weaponising good practice against neonatal nurses.
Yeah, I agree. So we'll move on to child eye, see what I said here. So some details on child eye, very vulnerable infant. Um, Baby I's mother recalled Lucy helping her give her daughter her first bath, but also told the public inquiry, like Baby D's mother, she too felt uncomfortable in the nurse's presence, and like Baby C's mother felt Letby also intruded into hers and her husband's grief immediately after Baby I died. Before I read any more, I just want to mention that all these have again, I have to emphasize, all of these things are coming after they've been prompted and after they've been told all these things. No, there was nothing.
Many years after. We're
Yeah,
not talking about even a couple of weeks. We're talking 5, 6, 7 years later.
yeah. I mean,
And
talking when
with
they
the
talk,
knowledge that the police are saying your baby didn't die of natural causes, which most of these parents had been told had happened, they're now talking about potential murder. Um, it's a different ball game.
one of the things that's important to emphasize as well is that if they had been told another nurse was the suspect, they would now be saying, "Oh, so and so nurse, yeah, she asked me if I wanted a cup of tea, but it wasn't really the right time, so I've just been, they would be bringing up some other recollection that has no relevance to anything." And I don't say that disrespectfully. It's not their fault. It's
No.
really, and we know. Again, I did Paul Hughes' thing the other day. The first thing he did, seemingly, according to his own words, in this investigation was go straight to the parents and tell them someone might have murdered your baby. We're investigating the circumstances. Was that appropriate? In my view, no, it wasn't appropriate. Whether it's something that they had to do legally, I don't know. Someone would have to tell me, but I can't. He had no medical information. He had nothing indicating any malfeasance whatsoever. Everything was pointing to the opposite. The only reason they even investigated was because of Ravi and Stephen Brearey walked in and told him gave him some information that was largely inaccurate. And then he's just gone straight to parents' house. By the way, someone might have killed your baby. I've seen. I can't say too much about this, and I'll make this comment as euphemistically as I possibly can. Someone I know well has had dealings with the police recently, in a vaguely similar situation. And she says they're always pestering me. Like I said, I've said to them, just leave me alone. I don't, I want to, I've got to deal with this situation. I don't want to be contacted. Leave me alone. And they just keep contacting her and saying, "Oh, do you want to know this? Do you want to know that? What about this? Are you okay?" And I don't know why they do it, but obviously they seem to think they have a duty of care, and maybe they do. But for me, it's deeply inappropriate to go to the parents first.
Well, I think it's a very fine line. I got told that some of these parents who are now very venomous about Lucy actually at the time were very grateful to Lucy
Hmm.
and forged a friendship of sorts. Um, but since the police have been knocking on their door, they've done a complete U-turn and absolutely hate her because they now think she murdered their baby. Um, the police, I mean, there were some parents who were very upset. Baby C's mother, I know in her testimony to Thirlwall, talked about she was really upset that the hospital hadn't informed her that her baby was potentially being looked at due to suboptimal care. It wasn't even murder at that point. And I think the police are probably in a similar situation that can you investigate potentially a crime without telling the victim that there was a crime or the potential victim? So I don't know. I don't know the law on it. I don't necessarily. I couldn't call the police out for doing that, but I think they should have had more information. But definitely the police made huge mistakes, as in they just believed Steve Brearey and Ravi Jairam. They didn't investigate them. They didn't look at other circumstances, which we've discussed. And then they had Dowie Evans rock up with his theories and thoughts, and they were then on the runaway train. And certainly when I spoke to them, I phoned them in 2018 about the staffing in the Royal College of Paediatric report. And they weren't interested. They just wanted to know if I worked with Lucy, if I knew Lucy, and did I have any evidence against Lucy. So they definitely had huge failings in that investigation. But whether it was wrong to go to the parents, I don't know, because I think if they'd have been investigating and then they'd gone to the parents and said, "Well, we've investigated your baby," I think some of those parents would have been very upset that they weren't informed beforehand.
Hmm.
It's a difficult situation.
Yeah, yeah, I agree. So let's look at what was actually said here. She was smiling, kept going on about how she was present at our baby's first bath and how much our baby loved it. That's supposed to say baby eyes mother. I remember thinking at the time, what are you going on about? She's only ever had one bath and my husband never got to bath her. I just felt so sorry for him because he hasn't got that memory and I wish Lucy would just stop talking. I remember thinking, will he just go away? I was really uncomfortable and I just wanted her to leave. It was also weird that she kept smiling. I'd never really seen her smiling before. Eventually, I think she realized and stopped. It wasn't something we wanted to hear right then. So I put it down saying the wrong thing at the wrong time. However, I still thought her behavior was strange. Lucy sent a text message to a colleague hours before baby I died saying, we tried everything, just don't think she was strong enough this time. Sad, isn't it? She also sent a sympathy card to the couple, which she took a picture of while working on the neonatal unit on the morning of baby I's funeral, which other nurses attended. That image was found on a mobile phone when she was arrested more than 2.5 years later. So do you have any comment to make on that?
It's just as I say, it's weaponizing a nice action to make it seem macabre and just nasty, and it's not. As I say, I've sent bereavement cards. I've been to babies' funerals. Um, I'm still in contact with babies who are now in their 30s, nearly 40s, um, with their parents. It's just wrong how these parents have been gaslighted into thinking that this behavior is somehow malicious. And I don't think it's malicious at all. And certainly, if I'd have been there, I'd have probably done the same thing. But memories alter, don't they? As I say, I mean, some of my friends told me that some of these parents that Lucy was involved with after these parents had been bereaved were very grateful to her and to the other nurses on the unit. And for a while maintained contact. And that definitely does happen. I've had that experience. But then when you've got the police knocking on the door saying it's murder, your whole opinion we don't know what the police actually said to these parents, how they spun their story. So if it's in the context of Liz Hill and her articles, and definitely, I mean, when Lucy was charged, the press was appalling because they knew her name. They were calling her the Angel of Death. They were talking about how she was going to be the UK's biggest child serial killer. All of that was long before the trial. I think those sorts of comments by the media should be stopped. I think the law needs to change. That if you're going to have a big murder trial, you cannot prejudice that trial beforehand by naming people and calling them out before they've even got into a court.
Yeah.
And those parents would have seen those headlines long before the trial. And we know that the police also employed Dr. Claire Foster, who's a psychologist, who is on record as saying that she counselled the parents prior to the trial for a guilty verdict.
Yeah, absolutely. I just want to add, talking about memory again, just to give an example of how unreliable it can be that I like to cite. So I often hear sports people talking about fixtures that occurred in the past, and they'll say, "Oh yeah, we were 3-0 down after 20 minutes, and this happened." If you ever go back, if you ever hear someone talking about, if you ever go back and look at the actual game, they're almost always wrong about the details because the themes and like because your memory doesn't retain all the detail. It can't. You
No,
can't remember everything that happened to you. It's impossible.
it's there's a saying, isn't there? If two people have an argument, there's person A's version of the argument, there's person B's version of the argument, and somewhere in the middle is the truth.
Hmm.
And it's the same when you go for a job interview. It's well documented that in a job interview, only 20% of the applicants' answers will actually be remembered by the panel interviewing them.
Mm.
The,
Yeah.
the mind doesn't work that it remembers everything the way a video camera would. It plays tricks.
Yeah, I mean, it's very obvious if you think about it, because if I mean, I was saying this the other day when I was recording, this ridiculous thing about the shredder. So I said, let's put Nick Johnson in the witness box and say, right, Nick, I would now want you to give me a 100% accurate inventory of everything that's in your house. Obviously, he's not going to be able to do it. And if you think like, could you say, or could anyone say, what were you doing at 2:30 p.m. yesterday exactly? No, you couldn't. You couldn't. No one can do that. It's absolutely ridiculous.
But
Let 6 years
it's
ago.
like in the trial, Nick Johnson, to prove that Lucy was a liar, really called her out on what she was wearing when she was first arrested. Were you wearing pajamas? No. What color were they? You've got that wrong. You were actually in a pair of joggers and a sweatshirt. I mean, what on earth did that have to do with the trial? But from Nick Johnson's point of view, the prosecuting barrister, by calling Lucy out and her saying, well, I had pajamas on, and then he's going, oh, actually, you didn't. You had a pair of joggers on and they were this color, and, that proves you're a liar. It served him well, but it's not relevant to the court case. And if you're in a state of flux, you're in a state of high anxiety, you've been charged and you're in a court of law and your life depends on it. Is it really important whether you can remember whether you're wearing pajamas or a pair of joggers? It's nonsense.
Absolutely.
Complete nonsense.
Yeah, I agree. So we'll look at child O and child P. Shortly before the death of the second boy, baby P, Lucy told a senior consultant, he's not leaving here alive, is he? The consultant told the trial and public inquiry that it was a shocking remark and one which she had never heard from any other nurse or doctor during her career. Dr. ZA described Lucy as being inappropriately excited and animated after the triplets' deaths, and that she seemed to be enjoying putting together memory boxes for the parents. So before we go any further, I will just say that that's just an interpretation of her behaviour after the fact. What she's probably trying to do, rather than being inappropriately excited and animated, is she's trying to be, not wallow in what is a horrible situation. And at this time, they'd had numerous deaths on the unit. Probably everyone on the unit was feeling the stress and feeling the pressure, and she's probably just trying to bring something vaguely positive to what is a horrible situation. She probably wasn't excited at all. Very unlikely that she'd be excited. And to describe her as animated, that could mean various things in various contexts. But anyway, I'll continue reading.
But
One
it
of the
could also have been that she wanted to ensure that those memory boxes were as comprehensive as they possibly could be for these parents and that nothing was forgotten.
Yeah.
Not necessarily a bad thing. I mean, she could have just been, have we made sure that we have absolutely put everything for these parents that they need from the tragic loss of their babies. Again, it's how you tell a story, and it's been completely misrepresented.
Yeah, and so instead of being inappropriately excited and animated, you could say she was appropriately thorough and professional, essentially. It's just interpretation. And this is a very false, in my view, it's a false interpretation.
And also, you have to remember that by the time the baby's O and P died, that consultant would definitely have had the thought in her head that it was Lucy, because Steve Brearey and Ravi
Yeah.
were recruiting all the consultants into this. It's her, she's always here. We're pointing the finger. They'd had definitely all the consultants were chit-chatting about it, and they'd been heard in queues in the cafe talking about a murderer on the unit. James McCormack, the obstetrician, had stood up at a meeting and pointed the finger at the manager saying, you're harbouring a murderer. There was a lot of discussion going on amongst all the doctors by the time baby O and P died. So that consultant will have been looking at Lucy through clouded
Hmm.
judgment, clouded eyes, because the seed had been planted that these babies were dying due to her,
Yeah, that's a
without reflecting on their own clinical care.
yeah. I mean, it's a very important point. Hadn't really occurred to me, but I mean that's very, very important. And I won't read this bit because you're just saying the same thing again. So that's the end of Liz's article. So shall we sort of give a conclusion about what we think about it?
I mean, I'm a neonatal nurse, and I've learned so much through Lucy's case. I wish I hadn't, but I have.
Hmm.
And certainly, when you talk about journalists, I've definitely realised that there are a lot of journalists who make comments without doing due diligence, without investigating, and they just want to put their own story on things. The press is definitely, like the judiciary, not what I thought it was. And Liz Hull is up there with Judith Moritz and Jonathan Coffey. You know, she's got skin in the game. They've written a book twice now. They've done 3 panorama programs. The last panorama program, they've actually had to withdraw and change it because they put out false information. And Liz Hull's articles are no better. I know a lot of people have reported her to the Complaints Commission because she's put out false information. But all these people, they're in the same frame of mind of Dowie. They're not able to go, do you know what? There is a lot of other information here, and maybe we've got this wrong, and maybe we should take a step back and reread everything and look at it. And that's the mistake that politicians very often make. They're not able to apologize or to admit that they've done something wrong. And it is a huge failing in all walks of life, because I think the British public can be extremely forgiving, but you have to admit, I
Hmm.
got this wrong. I've done something wrong. I maybe misinterpreted it. I didn't look at this piece of evidence. And it's the same with the police. The police will never accept that they've got this terribly wrong. But I would have a much higher regard for them if they went, do you know what? Maybe we didn't investigate this. Lessons have to be learnt. We didn't investigate it properly. Lessons have to be learnt. And we need to go back to the CPS and the judiciary and look at how we handle complex cases that involve statisticians, medical information, I don't know, forensic information, computer information. The law has not moved on with technology at all. And it certainly has not moved on with medicine or with the way we interpret statistics. And the whole thing needs a radical overhaul. Otherwise, we're just going to have more and more miscarriages of justice.
Yeah.
And that's a waste of taxpayers' money. And we can't, in this country, we're in dire financial crisis. We can't afford all these miscarriages of justice and waste of money being chucked at things and inquiries that don't achieve anything.
I agree with every word. I've got nothing to add. You know what I mean? There's nothing I can add. I completely agree with you on every point. Um, okay, Michelle. So we're going to try and get into some viewers' questions now.
Okay.
So the first one is, and it's one that I've never had. I don't know if we're going to get through all these questions, but let's just take it steady. We can always have you back again. More things will have happened by then that we can talk
Yeah.
about. So let's start with the first one. So this is something I've never had a good answer for, and that we often discuss in the comments, is why Stephen Brearey became so fixated with Lucy so quickly. So I'd love to know why you think that is, or if you have any insight into that.
Oh, well, that's a very complex question. And I've spoken to numerous people who all have different theories on it. So, my originally, my theory was that Lucy was full time. She was working a lot of extra hours. So she was on the unit more than some of the other nurses. It's recorded that she was working some weeks 60 hours. So if you're working 60 hours compared with another nurse who's only working 15 hours or 20 hours, you are going to be on the unit more often. Plus, Lucy was registered, she was QIS trained, and she was ambitious. And she wanted to progress up the career ladder. And the way to progress up the career ladder is to gain experience. And tragically, nobody wants babies to be sick, but the way to progress up the career ladder is to care for really sick babies, because that's how you learn. So she was looking after a lot of these babies. She was at the resuscitations, though, you know, it's all hands on deck when there's a resuscitation. So that's not really surprising. So I originally thought they just thought they got an idea in the head. You know, they just got an idea in their head. She's always here. But they didn't do any self reflection. They just ran with it. And it grew. It just grew and grew and grew, the way witch hunts and misinformation has a habit of doing. Other people I've spoken to have said, no, he was covering up his own incompetences. Lucy, we know, was doing a lot of Datix reporting, and Steve Brearey, because he was the clinical lead for the neonatal unit, was the lead to look at the Datixes. So was he thinking, oh, we've got to shut this person up because they're reporting too many Datixes and it's going to reflect badly on the unit and therefore badly on me because I'm the clinical lead? That's certainly one theory that people have said to me. Was it actually the maternity side that planted the seed? Because we know that Jim McCormack, who was the consultant obstetrician and the head of the fetal medicine unit, definitely at the meeting in May 2016 stood up and pointed the finger at Ariane Powell, who was the unit manager, and said, you're harbouring a murderer. But I also got told by two separate people from the maternity side that at a data meeting in September 2015, when the death rate had first started to go up, he made a quip of, well, there's either really bad care on this unit or a serial killer at play. Mm. So did he plant the seed and then Steve Brearey ran with it? I don't know, and I don't think we will ever know, if I'm honest. It's there was rumours also, because Lucy had a liaison with one of the registrars, that Steve Brearey had made a pass at her. That's always been denied by Lucy when she was asked about it. But certainly, if you read some of the Thirlwall transcripts by some of the managers, there was a lot of chit chat that Steve Brearey had possibly made a pass at her. Maybe she'd rejected him and he didn't like it. Maybe I don't know, maybe he was jealous of her relationship with the registrar. Who knows? I can't answer why. I like to think that they weren't being malicious. They just got an idea in their heads and they didn't do due diligence and it just grew. And I would also like to think that they really regret what's gone on. Having said that, it goes back to my comment before, none of them have been brave enough to come forward and say, do you know what? Maybe we got this wrong. And maybe we need to go back to the police and the CPS and the judiciary and say, we're really sorry, we didn't do this maliciously, but please can somebody look at it? Because we've now got on our conscience the fact that potentially an innocent nurse is in jail and is going to die in jail. And we've got all these parents who think that their babies died when we could have actually been the contributing factor. And we need to review our clinical practice. We need to review what was going on. And we need to apologise. So I don't know. I'm sorry to that listener. I can't explain anymore.
That's a good answer. I mean, I think you're absolutely right that we'll never know. We will never know. So, and perhaps even he doesn't know. It's possible that even Stephen Brearey doesn't really know why he went down this route. Yeah. So, but I wanted to ask you that because you do know these people, and it's always interesting to hear your view. So I'm going to ask you some questions around Datix. Uh,
Okay.
so the first one is a simple question. What hospital policies or guidance were in place around the Datix system?
Right. Well, Datexes were actually invented back in the late 80s. They were introduced, to my memory, till probably the late 1990s, early 2000s in Chester. So a Datix report is to try and prevent mishaps happening. No, nobody, I don't believe anybody goes to work with the intention of forgetting to give a drug, miscalculating a drug, performing a procedure incorrectly, or whatever. So Datexes are supposed to be reported to prevent untoward events happening, or if they did happen, lessons to be learned from it so that it doesn't happen again. So I, like Lucy, used to do a lot of Datix reports, and Datix reports usually are looked at by the clinical governance officers, and once a month or once every 6 weeks, we would have a meeting. For the neonatal unit Datix reports, I would go, the manager would go, the clinical lead of the unit, who was John Gibbs or one of the other consultants, would go. The clinical governance officer would be there. Sometimes, if the unit wasn't busy and we could release staff, other staff would go as a learning exercise. And also, other doctors would go as a learning exercise, some of the junior doctors. And we would discuss what happened, who reported it, if anything had occurred, what needed to change. And sometimes you've got Datix reports that were always the same. I mean, one of the things that always happened that used to drive me mad was there's a drug called netlamycin, which is an antibiotic that you give to a baby, and then you have to check that it's not in the toxic range because it can affect a baby's hearing. And the baby would receive netlamycin, and then the second dose would be given at 18 hours. And for some reason, people couldn't calculate 18 hours because it's an odd number. So we always used to have incidents where netlamycin was either given too soon or too late. It was never given at 18 hours, and it was a reoccurring problem. I wanted to change the prescription charts to try and make the prescription charts easier to prescribe 18 hourly. And pharmacy wouldn't let me change them because they wanted standardized prescription charts across the trust. They didn't want standalone ones, which I always thought was ridiculous, but that's where we were. So we regularly used to have Datix reports with the same reoccurring problem because people just had a mental block at being able to calculate a drug to be given 18 hourly as opposed to the standard 4 hourly or 6 hourly or 12 hourly, which is quite easy to calculate. So that's just one example. Some Datix reports were far more serious. I know I've looked at lots of the Datix reports in Lucy's. There was basic things missing. So they were in one resuscitation and they had no sodium bicarbonate in the resuscitation drug box. That's just appalling. There was no equipment. I know that one of the babies who was being resuscitated, they wanted to put an intraosseous infusion up. They didn't have an intraosseous needle, so they ended up using a spinal needle. All of these things were Datexed, many of them by Lucy, and rightly so, because, again, it's another indication of how poor this unit had become, that they didn't even have basic equipment. If you've got a resuscitation drug box and you haven't got sodium bicarbonate in it, there is something definitely going awry.
Yeah.
So Datexes, they're very important and they have grown over the years. I mean, they're used more and more. There is, I've spoken to people who said, my consultant hated Datix reports because I suppose it does show up inadequacies and failures. Sorry. But yeah, they're a very useful tool. and they should be embraced and not rejected because they can help prevent mishaps and improve the system. They shouldn't be seen as a whipping tool to point the finger at somebody.
Yeah. So I've also spoken with several people who have said sometimes stuff that's written in Datix, even if it's correct, can be viewed unfavorably and that they're not always welcomed. So one question I was asked is, were there policies in place to protect nurses from retaliation if they reported something in good faith regarding the actions of a consultant?
To be honest, I never saw a protocol like that. And it never occurred to me naively that somebody would be picked on like that. I now know very differently. A very good friend of mine who is a nurse actually worked in Chester and was one of the 7 who was dispensed with at the same time as me, went to another hospital and had an appalling time by a consultant neonatologist to the point where she nearly had a nervous breakdown. It was dreadful. And she ended up just leaving and going to another hospital because she couldn't take the pressure anymore. I naively always thought we worked as a team, things were good, but then when I look back on my own experience, especially when I was being made redundant, that came as such a bolt out the blue. And I started to see things that I hadn't, red flags that I hadn't seen before. I never actually saw a protocol written down saying it would protect a nurse from a malicious act, because it might not have just been a doctor, in fairness. It could have been a nurse manager, it could have been another nurse. There were human resource protocols about if you have a complaint or you wanted to whistleblow, that sort of thing. But yes, hospitals can be quite toxic places and they have some very huge personalities in them. And it's an awful thing to say, but it's a dog eat dog world, I realize now. I've met so many people who've had really awful experiences within hospitals who are excellent clinicians and have just been treated appallingly. I don't think the NHS values its staff enough. I don't think it treats its staff well enough. You're permanently under pressure, permanently run ragged and tired, and then it's very easy for somebody to turn around and go, oh yeah, well, look what's happened. I mean, I loved nursing, adored it. Would I be a nurse again, knowing what I know now? I don't think I would.
Mm.
And I've certainly got friends who are very apprehensive about publicly defending Lucy, even though they do believe she's been witch hunted and scapegoated. Because, I mean, and some of them have actually said this to me, Michelle, there but for the grace of God go I, I'm still working. Are they going to turn around? I mean, one nurse actually said to me, if Lucy's exonerated, are they going to come back and start looking at all of us? That's an awful stress to be working under.
Yeah. So you've half answered a question that I was going to ask regarding colleagues and the whether so someone wanted to know, are you in touch with all colleagues, which you've answered. And is there any impact on the morale of staff within those organisations? Now we know serious questions are being asked about the police investigation and medical care at the hospital. The ongoing doubts must be affecting staff interactions. So I mean, it's clear that they are, but would you like to expand on that a little bit?
Yeah, I'm in contact with quite a few nurses, some of whom have retired now, but some of whom are still working clinically. As we talked about when we went through the Liz Hull articles, a lot of things which is good neonatal practice have been weaponized because of this trial, such as sending bereavement cards, building up relationships with parents and with families, all of that. And it's impacted on the parents because the parents have read about Lucy's case, and some of one of my friends who works in a big level 3 unit said or if we say we've got to take your baby off to the treatment room to do a procedure, the parents are now like, well, we'll come in with you, because the trust has gone. And once the trust has gone, that's very hard to put back into place. Things can be misinterpreted. Certainly, friends of mine who are still working in Chester, I mean, I don't know how they do it, if I'm honest, because Steve and Ravi are still there, and it must be very, very difficult
Yeah.
working under those circumstances. Um, and they are behind the scenes very apprehensive. And as I say, one of them said to me, if Lucy is exonerated, do you think they're going to come back and start looking at us?
Yeah, I mean, I think that's very unlikely because, Cheshire police would have to do the investigation.
Yeah.
They're not going to be.
I don't think that would happen either, but
I can see why she would think that way.
that doesn't remove the fear.
No, I can see why she would think that way for sure.
Yeah, that
He
doesn't
would.
remove the fear. Uh,
Um, yeah, it must be very surreal. I mean, how would you feel as a parent? I mean, how would you feel as a parent going into the hospital with it into the neonatal unit?
Well, the neonatal unit has now changed. You've got to remember that the unit that was when loose during the indictment, they then built another new unit, and now they've all moved into a completely new hospital that was opened in September. So it's a very different clinical environment. It's purpose built. It's modern. It's moved with the times. Though I did laugh when I read the press media thing from the Countess of Chester promoting this unit. And I did crack out laughing because I thought, oh, that's just ridiculous. And it would say, it's fantastic. And we have lifts to all floors. Well, surely any hospital should have a lift to all floors. And they've got breastfeeding rooms. Well, they're a maternity hospital, so they should have breastfeeding rooms. I mean, there was a lot of things put out in this press release to promote this new hospital that I just thought, oh, that's just a nonsense. One of the things they really wanted to promote was that this is a net zero hospital now, and it's fuel efficient, and it's not got various things. And I mean, that's all lovely and it's nice, but if you haven't got the appropriate staff, the problems that were caused during the indictment are going to occur in a net zero hospital as much as in an old hospital that's falling to pieces.
Yeah.
So I hope they've looked at the staffing. I hope they've looked at not just the staffing on the neonatal unit, but certainly on the maternity side, because if you haven't got enough midwives or obstetricians, then the problems that some of these babies on the indictment had are going to be the same problems.
Yeah, absolutely. So to change tack a little bit, I've got a question here about saline and injecting drugs through a fluid bag.
Okay.
So there's an explanation of saline being packaged in a clear outer bag, and it's stated any healthcare professional would discard a fluid bag of any type if the outer packaging is damaged. So
Yeah.
how would it be possible to inject a drug through a fluid bag which is sealed in an outer bag?
Right. Well, in the old days, we used to inject things into saline bags, dextrose bags all the time, and there is a porthole on an infusion bag that you can puncture with a needle to inject a given drug into. And to withdraw saline, because sometimes you might wish to withdraw saline to mix a drug up if it comes in a dried format, like a powder. Sometimes you have glass ampules that you can dilute it with, but sometimes if it's a big amount you want, like 50 mils or 100 mils, you would take it from a bag of saline. So there is a porthole on those. They're right that the bags come with an outer plastic that you tear open, take the bag out, and then there's usually three portholes: one to put the giving set into, one that you can remove fluid or inject drugs into, and then the third porthole used to be used for what's called CVAS, which was if they were being used in the sterile pharmacy unit. Now, There are pre-made bags that are stored on the unit that come with various additives into them, and they used to be stored in the fridge, and they come from this sterile pharmacy unit. It's a bit of a problem because when a bag comes, it will have a label on it, even if it's personally made up. So say a baby needs what's called temporary parental nutrition. The prescription's done in the morning, it goes to pharmacy. Pharmacy in their sterile unit, people will gown up and will take a bag of dextrose and inject it with everything from multivitamins to calcium to magnesium to whatever that specific baby requires. And then it would come to the unit and you would check the label. But when you check the label and you're checking it against the prescription, it would have the baby's name, their hospital number, their date of birth, and what's in the bag. So it would say magnesium, calcium, whatever. But you don't actually know if that's correct. You're cross-referencing it from a prescription chart to the label on the bag, but you don't actually know if what's been administered into that bag is correct because you weren't in pharmacy. So problems can occur. We once had a baby who had an incredibly high potassium, really high potassium, and we couldn't figure out why this baby had such a high potassium. And eventually, after a number of days, somebody said, we need to check what's in the TPN bags. And the TPNs were being made up every day. But apparently, for whatever reason, it was an accident. Pharmacy had miscalculated the potassium they were putting in, which clearly explained why this baby had such high blood potassiums. So things do go wrong, not just on the neonatal unit, but in other areas, which nobody seems to have discussed, that things can go wrong in pharmacy. Certainly, going back to the Datix reports, those drug boxes, which are made up by pharmacy for whatever reason, had no sodium bicarbonate in. That's a big red flag. So yes, you can add or take things out of the bags. Having said that, this is a busy intensive care unit. If you were suddenly to inject something into a bag of saline, somebody would be saying, well, what are you doing? Have you had that checked? It always has to be two nurses checking anything that's administered or put into a bag, and it's checked against a prescription that's been written by a doctor. Sometimes it might not be two nurses, it might be a doctor and a nurse. So I cannot envisage how Lucy supposedly injected these bags. And also they talk, it was supposedly insulin, and we only ever kept 2 ampules of insulin in the fridge. One was fast acting and one was a slow acting one. There's no reports that pharmacy said the insulin was missing or had, they were having to restock it. So Helen Shannon, who is one of the new experts on the insulin in the expert reports, said to me that in a bag, a 500 ml bag, they would have had to use so many ampules of insulin. Well, where did she get all these ampules of insulin from when there's only ever 2 kept on the unit? Somebody else said, oh, well, actually, there were 6 on the unit, but that's been misrepresented. That was 6 ampules over a 12-month period. So pharmacy were replacing ampules that probably were out of date because insulin goes out of date. And that certainly, and it's not very often used on a neonatal unit. So pharmacy had reported that over a 12-month period, they'd put 6 ampules on the unit. But that doesn't mean that 6 ampules they weren't there all at the same time. It was over a 12-month period. So where did Lucy get all these ampules to inject into a bag? It's another nonsense. And Lucy on the stand was sort of press ganged into admitting that the insulin was in the bag, but she also said, but it wasn't me. But but she doesn't really have the expertise to say whether the insulin's in the bag. That was just a theory that the prosecution came up with, that the insulin must be in one of these bags. And Lucy went, well, if you say so, but it wasn't me who put it in there. But in actual fact, there's no evidence that there was any insulin in any of the bags.
None
It's,
whatsoever.
it's just a theory and a hypothesis.
Yeah. Just to add briefly, I've always felt that I found it extraordinary when I first started dealing with this case over 2 years ago that there was no attempt to demonstrate Lucy accessed this insulin at this time. She accessed this amount of insulin, this amount of insulin had gone missing. That was a red flag. There was
Yeah,
no attempt to do that at all,
yeah.
which I found incredible. I found it
And quite,
incredible that you can just say, as you rightly say, Michelle, oh, we reckon it just went in this bag. With no proof, not even any evidence, never mind proof.
no, pharmacy never reported insulin missing, insulin ampules missing. They never, it's, and as I say, Helen says that you'd have to, in a 500 ml bag, to get the levels that were on those um, immunoassay tests, the C peptide and the insulin results, you would have to be putting at least 6 ampules into a bag. Well, there wasn't 6 ampules on the unit.
Hmm. Yeah,
It's just further nonsense.
absolutely. So let's ask you this question about CPD. So I believe that's continuous personal development. Is that correct?
Yes.
Yeah.
Yeah.
Were people on the unit keeping up to date by periodically working the level 3 unit or doing training courses? Do you know anything about that?
There was a lot of training courses. So nearly every nurse, registered nurse, would do what's called the QIS training, which is quality in speciality. It used to be called the 405 course. And in my day, it was a 6 month course in a level 3 unit. It's now 2 3 month secondments to a level 3 unit. So one is about special care, and then the second half is high dependency and intensive care. And Lucy had done that QIS training. Nearly every nurse on the unit had done the QIS training. Of course, then you had advanced neonatal nurse practitioners, which was like me, and there was another nurse who just qualified, but then they said, no, we changed our mind, we're not giving you a job, so she left. And then in the middle, there was a course developed which used to be called the R23, which was specifically about intensive care and was a sort of a bridging course between QIS training and ANMP training, which is what I had. And some of the nurses in Chester definitely had undertaken that course, the band sixes, not all of the band sixes, but some of the band sixes. The problem was that the registered nurses had been reduced in numbers. So in my day, we would have at least 4 to 5 registered nurses on duty and 2 nursery nurses. You only have to look at the baby K trial, where there was only 3 registered nurses on duty and 3 nursery nurses. So the whole skill mix had changed. So that's why Lucy was deemed to be senior, even though she'd only been qualified for 3 years.
Hmm.
But yes, and they all have to do every year. There's basic requirements you have to do. You have to do the neonatal resuscitation course to keep your skills up to date with CPR, etc. There will be various courses you have to do to maintain your registration. And every 3 years with the NMC, you have to submit various documentation of study days that you've been on and further education that you've taken. Once you've actually done your courses, you don't necessarily return to a level 3 unit. And definitely the consultants didn't return to level 3 units to maintain their clinical skills, which possibly is something that needs looking at.
I was going to say, do you think it's a missed opportunity to should more nurses have had the opportunity to do that?
In an ideal world, yes, but there is not enough nurses anyway, and there's cost implications. It's in an ideal situation, yes, everybody should be going, including the consultants. But in reality, that doesn't happen. If you look at Sandy Bowen's CV, so she says she's a neonatologist. She did work in a big level 3 in Leicester, but that was 20 years ago. She now works in a two-cotted, it's literally got two cots in Jersey, special care baby unit. Any baby born there that is sick is immediately flown out to a big level 3 on the mainland. But on her CV, she says that she goes to, I think it was Bristol, every year to maintain her skills. I'd really like somebody to ask Bristol how many times she's been over there to maintain her skills, because I suspect it looks good on her CV, but I doubt whether she's ever been over there. Maybe once years ago.
Sure, sure. So here's another question. So I believe this is from a nurse that works in the States or has worked in the States, and she's talking about how a lot of stock will not be kept around because it's considered dead money.
Oh,
Um, yeah,
that's definitely true.
yeah. So she just wanted to know because there's this incident where there's an endotracheal tube that is the wrong size. I think it's maybe in a couple of cases where this is significant, maybe even more than a couple. And she just wonders, is it possible that they just didn't have the right size ones due to this
Right.
phenomenon?
I don't think the ET tubes were the wrong size due to not keeping them on the unit. I think it was more due to the fact that junior doctors couldn't intubate. So we certainly know with baby K that Ravi allowed the registrar to intubate that baby 3 times and he couldn't get a size 2.5 tube down. So he put a size 2 down. Now, lots of units actually don't stock a size 2 anymore because inevitably they never fit properly and they create a huge air leak. But in Chester, they did keep size 2 tubes. So I don't think the ET tubes is because they weren't stocking the right size tubes. However, we do know from, sorry, my dog's barking. We do know from the intraosseous that they didn't have any intraosseous needles, which is probably because they're expensive and they weren't used that often. So they were having to use a spinal needle. And I think out of Thirlwall, it's come across that Ariane Powell said that she was going to order some specifically for the unit. There definitely is an ethos of not keeping a lot of stock because it's expensive. So when I was there, I had an incident where we had triplets on labour ward and we were down to our last 5 long lines. Long lines at the time used to come in boxes of 10. They were £900 a box, so £90 a line. And we only had 5 and we had triplets. And of course, you never know if twins are going to come in or even singletons. So it was a bank holiday weekend. It was Easter. So we borrowed a box off Arrow Park. And that happens a lot. You borrow equipment, you borrow drugs, you borrow all sorts of things. So they sent us a box. But obviously, they're not going to give us a £900 box of long lines. They want it back. So when the manager came in on the Tuesday morning after Easter Monday, she did an order asking for 2 boxes, which would have been £1,800. So the order goes off. So she's going to restock us and she's going to restock Arrow Park. The order goes off, but when the box comes, there's only 1 box because somebody in some ivory tower had gone, oh, they don't need 2 boxes, but didn't think to pick up the phone and say, could you just explain to me why you're ordering 2 boxes? So 1 box came, and by this time we're into another bank holiday. We're coming up to the May bank holiday, and we're in the same position that we're now down to 3 long lines because we've used nearly all the box from Arrow Park. The 1 box that arrived has gone back to Arrow Park. So then they have to do an emergency order that costs them an extra £500 to have it curried up to make sure that we're restocked. Now, if that happens and is replicated in every department across the NHS, there's a lot of money being wasted on emergency orders because somebody in some ivory tower doesn't think, oh, I'm just going to check with this manager, why have you ordered 2 boxes? Because if they'd have kept that order, even though it was £1,800, we would have been restocked and so would our park. But that sort of thing happens all the time.
Yeah, that's interesting. And then another kind of unit related issue is sanitation. Obviously, a plumber is called in court to discuss what we know to be the poor sanitary conditions on the unit. So some want to know, with whom does the responsibility lie for the conditions on the unit and how would such issues be handled?
Well, it's a combination. I mean, that unit was a very old unit, built in the late 1970s. We always had problems with the plumbing, with hot water, with sewage coming up, with we had an outbreak of black flies once through the ceiling. But it wasn't just the neonatal unit. I mean, that happened on the pediatric ward, it happened on the labour ward, it happened within every department based within that building because it was an old building. So the manager would always report it. We know that Ariane Powell was very concerned, was filling in Datixes, was phoning the estates department. The estates department were trying to fix things as much as they could. But again, there's cost implications. It was just passing the buck all the time and trying to fix things without ever addressing the real problem. And the real problem was that it was an old hospital and it needed replacing. Now they've got an all singing, all dancing brand new, which opened in September. But that unit needed knocking down 20 years ago.
Yeah. Yeah.
So, you know, is it the estate's problem? Is it the senior management who decide where the money goes? Is it the government? Is it the Department of Health? In fairness to the estates, they always tried to fix things, but it was just make do amend all the time.
So at the time of the allegations that are levelled at Lucy, it's not as if this wasn't known to be the case. So it was known on the unit that it was the case. And the consultants and for example, the pediatric lead, they would have primary responsibility for the unit in a sense. So shouldn't it be, wouldn't they have a responsibility to escalate this?
Well, the manager definitely was escalating it. We've seen lots of Datix reports and emails from Ariane Powell. These consultants were not actually a visible presence on the unit. We know from the Royal College report they were doing 2 ward rounds a week, and they weren't really interested.
Mm.
Uh, they weren't there, and they weren't. I think they'd coasted for so long with the poor staffing, but then in this particular indictment period, the number of sick babies coming in increased. We know they were only funded for 15 cots, but certainly in December 2015, they had 21 babies on that unit. So they had 6 babies more than they were even funded for. And no wonder Alison Timmis wrote to management saying they were running out of basic equipment such as incubators. And that they didn't have any staff. And she, in that email, she puts it's going to result in children's lives or the physical and mental well-being of our staff. Steve Brearey got an idea. It was Lucy. He didn't do any self-reflection. I think they'd coasted for such a long time with poor staffing, poor building, problems. But the death rate had remained at 3. But then it's like a roller coaster. They got to a point where everything was increasing. They needed more staff. Ariane Powell wrote a business case in January 2016 asking for 10 registered nurses. They had inappropriately trained staff. They had too many nursery nurses who were looking after babies beyond their capabilities. It just became all the perfect storm. And those consultants, they did have a moral and ethical duty, but Nobody did any self-reflection here. Nobody actually ever joined up the dots. And then when they went to the police didn't join up the dots and look at other circumstances.
Yeah.
They just believed what Steve Brearey and Ravi said.
Yeah.
And you know, we know that Ravi's lied. I mean, Ravi didn't tell anybody about baby K for over 12 months. And then in court, he said, oh, I walked in and caught Lucy and she wasn't doing anything. Well, if you'd have walked in on me, that I would have appeared not to be doing anything, but that doesn't mean you're actually not doing anything. It means you're assessing that baby. And then it turns out that he'd written an email 5 years before saying actually Lucy did call for help.
Yeah. Yeah. So speaking of excuse me, child K, this will be our final question for today. Someone has written, isn't it obvious from the evidence of Caroline Oakley and Joanne Williams that the alarm did go off and that Lucy was not in the room at the time? To get from nursery 2 to nursery 1, she would have had to pass Ravi Jairam. He made no mention of that.
Yeah. So there's a lot of confusion about baby K. So there was only 3 registered nurses on duty that night.
Okay.
There was 3 babies in high dependency. 2 Lucy was looking after and 1 Joe Williams was looking after. And there was 2 babies in intensive care that Caroline Oakley was looking after. When baby K delivered at 12 minutes past 2 in the morning, Joanne Williams went to look after baby K, which left Lucy with 3 babies in high dependency then to care for. Now, there's talk that because of the swipe data, but I don't really believe the swipe data, and we certainly know the CPS have admitted they got it the wrong way round, that Caroline Oakley had left the unit for whatever reason. We don't know why. Caroline Oakley in court said she couldn't remember, and she was just going off her notes that she'd made in the babies that she was looking after. Joanne Williams had gone to talk to baby K's parents. And then Ravi said that Lucy was in nursery 1 babysitting and he walked in and she wasn't doing anything. Now, I really struggle with all of that because who was looking after the 3 babies in high dependency? You never leave babies in high dependency or in intensive care not monitored. Does that mean that a nursery nurse was in high dependency, which is a huge red flag? If you've only got 3 registered nurses on the unit, why would 2 leave? That doesn't make sense to me either. Caroline Oakley is not dissimilar looking from Lucy. So did Ravi walk in and actually see Caroline Oakley there, or was it Lucy? You're absolutely right. For Lucy to leave high dependency and get into intensive care, she would have had to walk past Ravi, who was sitting at the nurse's station. I mean, none of it just makes sense. Ravi is also not a reliable witness because this is now nearly 4 o'clock in the morning. He's worked all day. He's been called out at 2 o'clock in the morning. He's sleep deprived. Did he get confused? I don't know. In the trial, he said that Lucy didn't call him and there was no alarm going off. Joanne Williams says that when she was coming back, she heard the alarm going off. He then says in the email that Lucy had called him. I don't know. The whole story does not make sense to me at all. And I think the police should be investigating Ravi now for, I'm not saying he deliberately lied, but he definitely changed his story on more than one occasion. And we now have evidence that the story he told in court was not the story he put in the emails.
Yeah, absolutely undeniable.
And if he had any conscience and wanted to redeem himself from this dire mess, he should hold his hands up and go to the police and the CPS and phone Mark MacDonald, Lucy's new barrister, and say, I didn't intend to make a mistake. I didn't intend to mislead the jury, but I think my mind has played tricks on me and we need to relook at this baby because maybe I did get it wrong. We know the CPS got it wrong. And in fairness to the CPS, they've held their hands up and admitted it, that they got the swipe data wrong. I think Ravi should do the same. And then he's got a chance of being redeemed. but
Yes.
his silence is deafening.
Yeah, absolutely. Well, I won't comment any further on that. I agree. I'll just say that thank you for joining us today. We're going to leave it there. If you sent a question for Michelle, I've still got it written down here. Um, we'll maybe start with the questions next time. You never know what's going to happen between now and then, though. So who knows what Dr. Evans will do next? Um, but I've still got I have written down virtually every question. There are a couple that were a little bit personal regarding Ravi and Steve and Brearey that I didn't feel we could address. But I've written down 95% of the questions that I was given, so we'll get back into them the next time that I host Michelle. But I don't want to keep her all day because we will, if we answer all these questions, we will be here for 4 hours to 4 to 5 hours. So we'll just let you leave now. So thanks again for joining us. Thanks for sharing your expertise and your knowledge. It's very, very much appreciated. I know people love listening to these, and I do as well. It's mostly you speaking, rightly so. So we'll see you again soon, and thanks again.
Well, thank you for having me, and I look forward to speaking with you again in the future.
Yeah, we'll do. Take care.
Take care.